I was born in Owensboro, Kentucky. All of my family are farmers. I enjoyed working on the farm as I grew up. We had cattle, we had hogs, we had sheep, and so you have a focus on what you want to achieve, what you want to get done.
The strong work ethic cultivated in Mark Newman's youth is clearly evident in his adult life. With a passion ignited at Duke under the mentorship of famed anesthesiologist Jerry Reeves, Newman pioneered pre- and post-operative risk factors that can lead to neurocognitive decline and mood changes following prolonged anesthesia, particularly during cardiac surgery. His discoveries regarding the management of body temperature and glucose levels to improve cognitive outcomes are used around the world today.
And we found out that if we rewarmed more slowly to a lower peak temperature, that patients did better. And so the idea was we could continue and change practice across the country, and I think we've seen that.
Working with a multidisciplinary team, Newman also has developed a highly successful perioperative genomic assessment that collects information about the genetics and mechanisms behind cognitive loss following surgery.
And I really think that's the future, understanding better so that we can give the best treatment to each individual.
In 2012, Newman completed a large-scale international trial on coronary artery bypass grafting, aimed at reducing heart attacks and strokes during cardiac surgery. Newman earned an undergraduate degree in biology from Western Kentucky University and a medical degree from the University of Louisville. Because of his extensive experience with farm animals, he thought early on about veterinary medicine. But
I enjoyed more feedback with my patients than I was getting and thinking about taking care of animals.
Following residency at Wilford Hall U.S. Air Force Medical Center in San Antonio, Texas, he came to Duke in 1988 for a one-year fellowship under Dr. Reeves.
He pushed me just enough and gave me the support that I needed to be able to achieve the things that I probably didn't even see as possible when I started.
He then held joint appointments for 2 years at Wilford Hall and the University of Texas Health Sciences Center, and was deployed for Operation Just Cause in Panama and Operations Desert Shield and Desert Storm in the Persian Gulf. He returned to Duke in 1992 as Assistant Professor of Anesthesiology and was named Chief of the Division of Cardiothoracic Anesthesiology in 1994. In 2001, he was named Chair of the Department of Anesthesiology. He was President of the Duke Private Diagnostic Clinic from 2014 to 2017. In 2010, the University of Louisville honored Newman with a Distinguished Alumni Award. Newman left Duke in 2017 for the University of Kentucky as Executive Vice President for Health Affairs.
I've always told our faculty and residents that Duke is a launching pad. It's a place where people come, they get the great resources and the great opportunities, and they take advantage of them, and then they get to go on to other things because of all the experiences they've had at Duke. And now it's my turn, and I thank everyone for the opportunities and the resources that I've had.
Newman has been married to his wife Susan for 37 years.
She's been the support. She also sees more in me than I often see in myself.
They have 3 adult children, Catherine, Jack, and Sarah. Outside of medicine, Newman stays true to his farming and small-town roots. But his biggest passion is wine collecting.
We really enjoy doing this with friends and colleagues so that we can experience it together. As a last note, I just wanted to say to all the awardees this year, congratulations and cheers.